Hello, everyone. My name is Rebecca Dudley.
My name is Nazir Kochak.
I'm Carl David Getty-Luciak.
I'm Olivia Rappa.
And we're here this evening as a policy analysis team to bring up to speed all the levels of the Virginia Hospital and Healthcare Association, which is Virginia's most important lobbyist group for healthcare policy in Virginia. So we'll start first by defining the problem.
The basic problem that Virginia currently faces is twofold. First, with the implementation of the Affordable Care Act, the qualifications for federally subsidized health care have expanded. However, the general pool of federal funding that results from Medicaid pays for that subsidized health care. The Supreme Court mandated in June of 2012 that states have the option of expanding Medicaid. Thus, the first problem is this: Virginia has chosen not to expand Medicaid. So while the federal government has increased the amount of people who are eligible for health care, the states who decide to not expand Medicaid won't receive any additional federal funding to cover the costs of these newly eligible individuals. There is a gap of people who now qualify for subsidized health care, but Virginia is unable to provide the funding for those individuals without an expansion in Medicaid, as this is the central funding source to cover the Affordable Care Act on the state level. The second part of the problem is this: alongside this lack of expansion, there's a federal phasing out of the disproportionate shares to hospitals, or DSH program, which is a supplementary federal funding given to hospitals to cover such costs and charity care. This leaves many Virginians in the strange situation of qualifying for health care, but their state not having the funds to cover costs, leaving hospitals, small businesses, and other insured individuals to bear the losses. By law, hospitals must provide care when it's needed. When patients come in who cannot pay their bills, the hospital has to front this cost. Previously, the federal government has subsidized hospitals who provide this charity care by giving them funds through the federally funded DSH program. As the DSH program is phased out with the implementation of the Affordable Care Act, those hospitals in poorer or rural areas are more affected than those in richer or suburban areas, because these are the hospitals that will give the most charity care. This will result in hospitals being driven to the point of closing because there's only so much cost they can incur before taking serious losses and shutting down. A strong example of this is even UVA's premier healthcare system is at risk of losing $40 million annually, according to their CEO, Edward Howell. This means hospital closings resulting in job losses and little to no means of accessible health care in rural areas of Virginia. This is the general problem. We need Medicaid expansion in Virginia to be able to cover health care costs for newly covered individuals and to allow for hospitals to continue to function while providing the care that they are mandated to provide. Now we will move to Ms. Dudley to discuss key stakeholders in this policy issue.
So there are three main stakeholders involved in the expansion of Medicaid in Virginia. Firstly, hospitals and medical providers. Secondly, businesses. And thirdly, taxpayers and patients. Each of these groups has something to gain or lose by the expansion of Medicaid. As Ms. Kochar explained, the main issues that hospitals and medical providers in Virginia face are the reducing subsidies for charity care or care that's given out to patients who can't then pay their bills. This pinch is already being felt in big hospitals. When I spoke with Cheryl Garland, the Vice President for Health Policy and Community Relations for the VCU Health System, she explained to me that since these cutbacks began on October 1st of this year, VCU has already experienced the added stress of fewer DSH dollars. Another example is Lee Regional Medical Center, a 70-bed hospital in Lee County, Virginia, that had to close its doors on October 1st, the day the DSH cuts went into effect. This should stress how tenuous many hospitals' finances are. Yet another example is the pinch felt by the Riverside Health System, since their hospitals are primarily situated in poorer, rural areas. Thus, many of their patients are uninsured and receive most of their care through the emergency room. With the phasing out of DSH subsidies, Riverside hospitals and hospitals like them will need to cut costs or otherwise pass along these costs if they want to continue to operate. Thus, a spillover effect begins. As healthcare providers cut costs and raise fees, this results on the one hand in cutbacks on the inputs they require, and on the other hand, on increasing costs for those people who are insured. This means that not only contractors will suffer, like laundry companies who provide linen services and food companies that provide food services, but also small businesses who provide health care insurance to their employees will face higher premiums as the cost of health care rises. In addition to the businesses affected by not expanding Medicaid, taxpayers and patients, both insured and uninsured, are also directly impacted. They suffer from the lower quality of care, longer wait times, and higher costs. Furthermore, lower and mid-level hospital and healthcare workers will suffer as their benefits are reduced and their workloads are increased. When we spoke to the chairman of the Riverside Medical Group, he noted that the lowest level employees are going to be those most impacted by these increasing costs. Thus, the job security of these lower and mid-level employees becomes tenuous. Now, Carl David will talk about the political climate surrounding the expansion of Medicaid.
Thanks so much. Virginia is currently at a crucial juncture in the healthcare debate. Never has it been so important to take action to expand Medicaid and to stress the urgency of doing so. Terry McAuliffe was elected to be the next Virginia governor on a 3% margin and campaigned on a platform that included Medicaid expansion. However, 53% of Virginia voters continue to stand opposed to the Affordable Care Act. And since the 2012 Supreme Court ruling, the decision is now left up to the states with regards to implementation. The Virginia General Assembly is facing significant pressure from the Koch brothers' Americans for Prosperity. This lobby has managed to make their voice unavoidable for both House and Senate representatives. We need to build a counterbalance to this political pressure. And if we are to achieve Medicaid expansion soon, we need to focus that pressure on the Medicaid Innovation and Reform Commission, or MIRC. Both houses currently have delegated their decision-making responsibilities on Medicaid expansion to this ad hoc panel. The panel, made up of 5 senators, 5 House delegates, and 2 non-voting members, is a commission that will ultimately come up with a recommendation on Medicaid that it will take back to their respective houses and budget committees. In order to expand Medicaid, 3 of the 5 members from each of the houses in this commission will have to vote yea. And my colleague Olivia Rapa will detail the specifics of implementing our strategy vis-a-vis the members of the MIRC. But first, I will outline broadly our tactics. Our strategy for expanding Medicaid in Virginia focuses on achieving a positive proposal from the MIRC. We see 2 possible routes to succeeding in this aim. One, focused on individual MIRC members, and a second, through working with Bill Hazel, the Secretary of Virginia's Department of Health. The first strategic route involves a 3-pronged approach to applying political pressure. The first prong of our strategy is to encourage representatives to expand Medicaid by leveraging hospital networks in their districts who would face substantial, perhaps even fatal costs if Medicaid is not expanded. This means reaching out to hospitals to help us emphasize the cost and potential loss of jobs for all those workers that my colleague Ms. Dudley outlined earlier. The second prong of our approach will be to mobilize local businesses in our target districts to make calls and appointments with their House delegates, urging them to expand Medicaid. Again, businesses working in healthcare stand to lose work, and numerous businesses providing healthcare to employees could face insurmountable costs as a result. So, these groups should be easily mobilized to apply pressure, and the VHHA is already working with businesses on the issue and has the support of many local chambers of commerce. We need to apply this focus and this support on our target members. Finally, the third prong of our approach is purely grassroots. Americans for Prosperity make their presence known through sheer numbers, with door-to-door visits asking people to call their representatives and the placement of people in green t-shirts at town hall meetings. We need to mobilize people on the other side and give our position an equally effective popular face. We want to work with groups like Virginia Organizing to pack concerned citizens into buses, get them to the Virginia General Assembly, and put the human cost home to our politicians in their own offices. We need representatives to know that they will stand not only to lose business and medical sector support, but also the votes of individuals dependent on those firms for their livelihoods and well-being, or otherwise impacted as patients in the system. This 3-pronged approach would build up pressure on our key representatives from all sides. local businesses and the Chamber of Commerce, local healthcare providers, and the general citizenry. However, ideally, we would wield not only the stick of political pressure, but also offer some carrots. This is where Bill Hazel comes in our second strategic route. Bill Hazel is the Secretary of Virginia's Department of Health and the head of McDonald's Healthcare Reform Initiative. He's a non-voting member on the MIRC, but he has a good reputation of bipartisanship and is working with Republicans on a Virginia way to healthcare. We believe he's a crucial influence on the committee. Most importantly, in the word of Steve Lands, his job is to bend the cost curve for Virginia in terms of healthcare spending. In other words, his initiative is looking for ways to reform the way Virginia gives healthcare in order to keep costs down. If our coalitions and organizing efforts don't result in tangible commitments from delegates, then Hazel is our plan B, because he can provide the changes that should appeal to our conservative targets. Essentially, with grassroots organizing, mobilizing the business sector, and healthcare networks, we want to send a message to the General Assembly. The message is that we all stand to lose unless Medicaid is expanded, and that this is an immediate problem that will affect thousands of individuals as well as businesses and crucial healthcare providers. Additionally, in the long run, we can bend that cost curve and change some critical problems to the way healthcare is administered in Virginia. But that's a long-term goal, and in the short run, dire consequences are racing towards us. Therefore, expedient Medicaid expansion is a proposal we should all be able to agree on. Now, my colleague, Ms. Rappa, is going to take us through the specific implementation of the strategy I've outlined with regard to MIRC members.
Thank you, Carl. So, let's talk nuts and bolts. If you recall, the main decision-making body on the issue of Medicaid expansion is the Medicaid Innovation and Reform Commission, otherwise known as MERC. There are 5 senators and 5 delegates on the commission, and 3 of each are required as a yes vote before a recommendation is made to their respective houses. 4 out of the 5 senators have already openly stated that they would support Medicaid expansion. Therefore, our remaining opposition comes from the House. 2 of those House delegates on the commission, we believe, are intransigent on the issue. They have openly stated that they are against Medicaid expansion and have written many op-eds and met with many conservative groups outlining their position against Medicaid expansion. However, it is still possible with the remaining 3 votes to get the necessary yes votes on the commission before it is recommended to their houses. So let's go through the list. First, we have Jimmy Massey. Jimmy Massey is a Republican from Henrico, District 72, which encompasses a large part of northern Richmond. We already have letters from the 2 primary healthcare networks in his district, Bon Secours and HCA, and they both support our initiative. We also are working with their Chamber of Commerce to outline a brief to give to Massey, and we are hoping to arrange a meeting with local business leaders in the next month or so. Second, we have Johnny Joanno, a Democrat from Portsmouth, Virginia. Portsmouth has around 20 different healthcare providers, but the largest of whom, Bon Secours and Centera, have already written us in support of our initiative. Like Henrico, we are working with the local Chamber of Commerce in Portsmouth and are arranging a meeting to get local businesses in Joanno's office. Finally, we have Beverly Sherwood. Beverly Sherwood's position is interesting. Apparently, she hasn't attended any meetings and has made no public comment on the issue of Medicaid expansion, so we don't really know how favorable she will be to our initiative. Additionally, Delegate Lands, who we mentioned earlier as being a conservative no voter on the issue, has claimed that they are working to have her replaced on the commission. If she remains on the commission, or if she doesn't, our strategy is the same. If she remains, she is from Winchester, Virginia, which, while small, is home to Valley Health, which employs thousands of Virginians and brings in millions of revenue. Additionally, Winchester has an unemployment rate about 40% above the statewide average, so they would benefit exponentially by Medicaid expansion. If Sherwood is not or is replaced on the commission, the only element that we would have to change in this strategy is the district. We already have letters from, and I have them with me here today, from all of the major healthcare networks in Virginia. We are working with the chambers of commerce, so we have business leaders on our side. Everyone seems to understand that Medicaid expansion is an important and immediate step that is necessary for Virginia. As far as the on-the-ground effort goes, it's simple. 3 districts, 3 months. The VHHA already has the capabilities and organizing structures in place to work with groups like Virginia Organizing to mobilize an on-the-ground effort. All we need to do is direct that capacity to the 3 crucial delegates' districts. 47% of Virginians approve expanding Medicaid. We only need to make sure that those voices are heard. So, in conclusion, Medicaid expansion is a short-term necessity for Virginia. In the long run, we can bend the cost curve, but in the short run, we need to expand Medicaid. If we do not expand Medicaid, our tax dollars that we are paying to the federal government will go to the states that do expand Medicaid. This will result in millions of dollars of losses per year. The Virginia General Assembly appears poised to make a decision on Medicaid under the McAuliffe administration. We have identified 3 key delegates whose influence we believe will be critical in getting the House and Senate budget committees to vote yes on expanding Medicaid. They, like all delegates, are responsible to their districts. We, with the VHHA lobbying capacities, can mobilize their districts, given our 3-pronged approach. It's grassroots, it's smart, and it's political. By implementing this strategy, we can save billions in dollars of losses, ensuring that hospitals keep saving lives, businesses keep running, and Virginia tax dollars come back to Virginia. So now, I guess we would like to take the next 3 minutes to open the floor for questions. Minal Hill.
The pushing more tests to make more revenue, that's not quite what we're tackling in this policy proposal. That's more of a long-term adjustment in the healthcare system of adjusting incentives for doctors. And that's another issue that requires a lot of attention, but that's kind of beyond our realm here.
In our group, we believe that the 53% that do oppose expanding Medicaid aren't really realizing the full financial cost, at least in the short term. We think that this can be helped by the on-the-ground efforts, because in those grassroots efforts, we go to houses, we bring our presentations, we explain to people what we stand to lose, and then that will really open up the constituents' eyes to the severity of the problem.
Okay, so right now the current Medicaid standards in Virginia are pretty sparse compared to national standards. Medicaid standards, though it's funded through the federal government, the qualifications for Medicaid are set on a state-by-state basis. And right now in Virginia, to qualify for Medicaid, you have to be either 133% above the federal poverty level or above. That's 133% of that level. Or a child or pregnant woman. So right now, it's the qualifications that set who qualifies for Medicaid, and it would be an expansion of those qualifications to include the coverage gap that's not covered at the moment. Does that answer your question?
Yeah, I was just more asking about if there's, like, how they determine, because obviously there's more people qualified that aren't able to, like, get coverage, so that's not a waiting list basis or
No, if the qualifications were expanded, then all of those people who would be qualified for it, unless they didn't have insurance through their employers or another means, would get that coverage. It's a safety net.
I'll just add to that that would be the part of the budget that is Medicaid expansion. So that is what we are advocating for, is an expansion of those requirements.
First off, for staying around. But more importantly, all the slides were actually very good. You used them as background as opposed to presentation, so I compliment you on that. You did a lot of good comparisons, I think, on the options, and a lot of you really got into grassroots and targeted advocacy. So overall, I'm very, very